It's 6:47 in the morning. Your alarm hasn't gone off yet. But something woke you up anyway. Not noise, not pain, not a bad dream. Just your mouth. Your tongue feels like it's glued to the roof of your mouth. Your lips feel dry. That familiar sticky feeling is already there, before you've even had your first sip of water. If that sounds familiar, stay with me. Because most people think waking up with a dry mouth simply means they need to drink more water. But what if that's not the real reason? Here's something most people never hear. Your body produces around 1 to 1.5 liters of saliva every single day. Not occasionally, every single day. And saliva does far more than keep your mouth wet. It protects your teeth, helps you begin digesting food, and constantly defends your mouth against harmful bacteria. In other words, saliva is one of your body's first lines of defense. So if you wake up every morning and that defense system has gone quiet, your body may be trying to tell you something. It may even be screaming at you. Because in most cases, dry mouth isn't the problem. It's the signal. And today you'll discover 5 possible reasons why that signal may be appearing every morning after 60. Some of them may surprise you, and at least one of them may have nothing to do with dehydration. So why does this happen more often after 60? The answer begins with something most people never think about: your salivary glands. These small glands work quietly throughout the day and night, constantly producing saliva to protect your mouth, your teeth, and even the first stages of digestion. But like many systems in the body, they can gradually become less efficient with age. Research suggests that after 60, some of the cells responsible for producing saliva may become less active, and the amount of saliva produced during sleep may slowly decline. That means the same mouth that stayed comfortably moist all night for decades may gradually become much drier before morning arrives. But here's the part that matters most. For many people, aging alone is not the main reason they wake up with a dry mouth, because these natural changes are often being amplified by something else. Not one thing. 5 very common causes after 60. Causes that millions of people experience every day, without ever connecting them to the dry mouth they wake up with each morning. Some are related to medications, some are linked to conditions people don't even realize they have, and one of them affects women after menopause far more often than most people realize. So let's begin with the cause that affects more adults over 60 than any other. The one that's hiding in plain sight, right inside your medicine cabinet. Because number 1, and this one surprises almost everyone the first time they hear it, because it isn't a disease. It isn't a vitamin deficiency. It isn't something that shows up on a blood test. It's the medication sitting in your medicine cabinet right now. Here's a number that may genuinely stop you in your tracks. More than 400 commonly used medications, both prescription and over-the-counter, list dry mouth as a documented side effect. More than 400. We're talking about blood pressure medications, antihistamines, antidepressants, overactive bladder medications, and many others that millions of adults over 60 take every single day. But here's the part that most people never hear. The problem often isn't one medication, it's the combination. Each medication on its own may cause only mild dryness, but when several are taken together, their effects can build on one another. Research has found that older adults taking 5 or more daily medications experience significant dry mouth at nearly twice the rate of those taking 2 or fewer. And the average adult over 65 takes how many daily prescriptions? Between 4 and 5, before supplements, before over-the-counter products. I've had patients convinced something serious was wrong with their mouth. One of them, let's call him Gerald, was 71 years old, retired, careful about his health. He'd been waking up with severe dry mouth almost every morning for nearly 2 years. When he came to see me, I asked him to bring every bottle from his medicine cabinet. We lined them up across the desk: 6 prescription medications, 3 supplements, 2 over-the-counter products he used regularly. Within that lineup, I found 4 different products known to reduce saliva production. Not 1, 4, working together. After discussing the findings with his prescribing physician, 2 of those medications were simply moved to a different time of day. The doses didn't change. The medications didn't change, only the timing. 3 weeks later, Gerald told me his morning dry mouth had gone from a 9 out of 10 to about a 3. No expensive treatment, no miracle cure, just connecting the dots. So here's something you can do starting today. Write down every medication, vitamin, and supplement you take, including things like antihistamines, ibuprofen, melatonin, or any over-the-counter sleep aids. Then, take that list to your pharmacist and ask one simple question. Could the combination of anything on this list be affecting my saliva production? Pharmacists are experts in medication side effects and interactions, and that conversation is completely free, because sometimes it isn't one medication causing the problem. It's everything working together. But medications are only the first piece of the puzzle, because the second cause affects tens of millions of adults over 60, and most people don't even realize it's happening. Because number 2, and this one surprises more people than almost any other, because it has nothing to do with how much water you drink, nothing to do with your diet, and nothing to do with your salivary glands. It happens while you're asleep, and most people who have it have absolutely no idea. We're talking about obstructive sleep apnea. Here's what happens. While you're sleeping, the soft tissues at the back of your throat can temporarily collapse. Your airway narrows. Your brain senses that you're not getting enough air, and within seconds, it briefly pulls you out of deeper sleep just enough to reopen your airway. Most people never remember these awakenings, but their body does. And here's the connection most people never make. When your airway is blocked, your body automatically switches to breathing through your mouth, hour after hour, all night long. And mouth breathing allows saliva to evaporate far faster than breathing through your nose. So you wake up with an extremely dry mouth, not because you didn't drink enough water, but because your mouth has been open for hours. You wake up feeling like your mouth has been open all night, because it has. And that's what makes this cause so important after 60. Sleep apnea becomes much more common as we get older. Research has shown that untreated sleep apnea is associated with a higher risk of stroke, irregular heart rhythms, cardiovascular disease, and cognitive decline. In other words, the dry mouth may simply be the first clue, not the biggest problem. So how do you know if this might apply to you? Ask yourself a few simple questions. Do you snore loudly? Do you wake up feeling exhausted even after a full night's sleep? Do you often wake with morning headaches? Have you ever found yourself falling asleep in a chair during the day when you weren't planning to? If several of those sound familiar, especially alongside morning dry mouth, it's worth discussing a sleep study with your doctor. And here's something many people don't realize. Today, many sleep studies can be done at home using a small wearable device. No hospital, no overnight clinic, no complicated equipment. Sometimes, one conversation is all it takes to uncover a problem that's been hiding for years. Because if sleep apnea is causing your dry mouth, treating the sleep apnea may do far more than improve your mouth. It may protect your heart, your brain, and your independence. But sleep apnea is still something you can usually detect once you know what to look for. The third cause is different, because it can remain completely silent for months or even years before anyone connects it to something as ordinary as waking up with a dry mouth. Because number 3, and this is the one I especially don't want you to ignore, because it can remain completely silent. No pain, no dramatic warning signs, nothing that makes most people think something is wrong. Just a dry mouth every morning, and blood sugar that's been slowly rising for months or even years. Here's something many people don't realize. Millions of adults have elevated blood sugar without knowing it. And for some, a persistently dry mouth may be one of the earliest clues. So what does blood sugar have to do with your mouth? Here's the connection. When blood sugar remains consistently elevated, your kidneys have to work harder to remove the excess glucose from your bloodstream. To do that, they pull more water out of your body, little by little, day after day. The result isn't always obvious dehydration. It may simply be a mouth that feels unusually dry every morning. Research has found that persistent dry mouth is common among people with poorly controlled blood sugar, and in many cases, that symptom appeared long before diabetes was ever diagnosed. The mouth was warning them. Nobody connected the dots. Now I want to be very clear. Dry mouth by itself does not mean you have diabetes, but if it happens alongside other changes, it's worth paying attention. For example, are you urinating more often than you used to, especially during the night? Do you feel unusually tired even after getting enough sleep? Have small cuts started taking longer to heal? Has your vision occasionally become a little blurry? If several of those sound familiar, don't wait until your next routine checkup. Talk to your doctor and ask whether checking your blood sugar would be appropriate. A simple fasting glucose test and an HbA1c. That second test shows your average blood sugar over the past 3 months. It only takes a few minutes, but it may answer a question your body has been trying to ask for a very long time. Because sometimes, the simplest symptom is the earliest clue. The fourth cause is completely different. Because unlike blood sugar, most people think they already understand this one. But that belief may actually be making their dry mouth worse. Because number 4, and this is the one most people think they already understand, because the advice sounds obvious. If your mouth is dry, drink more water. Simple. Except it may not be that simple after 60. Here's why. Your body has a built-in system that tells you when it's time to drink. And when we're younger, that system works remarkably well. You lose water, you feel thirsty, you drink. But as we get older, that signal gradually becomes less reliable, which means something surprising can happen. You can be mildly dehydrated and not feel thirsty at all. No obvious warning, no strong urge to drink, just a dry mouth waiting for you the next morning. And that's where many people unknowingly make the problem worse. Because if you don't feel thirsty, you're naturally less likely to drink throughout the morning and afternoon. Then later in the day, you try to catch up. A few glasses with dinner, another before bed. Without realizing it, most of your hydration has shifted to the last few hours of the day. The result? Your body may spend most of the day slightly dehydrated, and your salivary glands never have enough time to fully recover before morning. So here's the practical takeaway. Don't wait until you feel thirsty. After 60, that signal isn't always as reliable as it used to be. Instead, drink steadily throughout the day, earlier, more consistently, not all at once, and not mostly in the evening. Because after 60, hydration isn't just about how much water you drink. It's about giving your body enough time to use it. But even people who hydrate well can still wake up with a dry mouth every morning, which tells us something important. Hydration isn't always the whole story. And for many women over 55, the fifth cause begins with changes that almost nobody talks about openly. Because number 5, and this is the one that surprises more people than almost any other, not because it's rare, but because it's so often mistaken for normal aging. Imagine this. Every morning your mouth feels dry. Your eyes feel irritated or gritty. Your joints ache for no obvious reason. And you're tired far more often than you think you should be. Most people treat those as 4 separate problems. Sometimes, they're actually connected. There's a condition called Sjögren syndrome that causes the immune system to mistakenly attack the glands that produce moisture. especially the salivary glands and the glands that produce tears. Over time, the body gradually loses its ability to keep the mouth and eyes properly lubricated. Now here's why this matters. Around 90% of people diagnosed with Sjögren syndrome are women, and the condition is most commonly diagnosed during the late 50s and early 60s. But here's the part that surprised me most. Research suggests that many people live with symptoms for 2 to 5 years before receiving the correct diagnosis. Why? Because those symptoms are usually explained away. Dry mouth. That's just getting older. Dry eyes? Use some eye drops. Fatigue? Everyone feels tired after 60. Joint pain? That's probably arthritis. And little by little, the pattern gets missed. If your morning dry mouth consistently comes alongside dry or irritated eyes, persistent fatigue, or joint discomfort that doesn't seem to have another explanation, it's worth mentioning Sjögren syndrome by name during your next medical appointment. Not because you should assume you have it, but because mentioning it may help your doctor decide whether it's something that deserves a closer look. Simple blood tests can often be part of that evaluation, because living with symptoms for years, when there may be an explanation, is something nobody should have to accept. And perhaps that's the biggest lesson from everything we've covered today. Morning dry mouth is common, but common is not the same as normal. And it is certainly not the same as something you simply have to accept. So, what should you actually do if you wake up with a dry mouth every morning? The first step is to look at what's already in your medicine cabinet. Write down every medication, supplement, and over-the-counter product you take regularly, including the ones most people forget to mention: antihistamines, sleep aids, ibuprofen, melatonin. Then, take that list to your pharmacist and ask one simple question. Could the combination of anything on this list be affecting my saliva production? That conversation is free, and it may reveal something no one has ever connected for you before. The second step is to pay attention to how you sleep. For 1 week, notice a few simple things each morning. Do you wake up with your mouth feeling unusually dry? Do you feel rested or still exhausted after what should have been a full night's sleep? And if you have a sleeping partner, ask whether you snore heavily or whether your breathing ever seems to pause during the night. If those patterns begin to appear, talk with your doctor about whether a sleep study might be appropriate. Many sleep studies today can be done right at home. No hospital, no overnight stay, just a small wearable device. And one conversation with your doctor. The third step is to review your blood sugar. If you haven't had a fasting glucose test and an HbA1c recently, consider asking your doctor whether it's time, especially if your dry mouth comes alongside increased thirst, frequent nighttime urination, unusual fatigue, or wounds that seem to heal more slowly than they used to. The fourth step is to look at when you drink water, not just how much. If most of your fluids happen in the afternoon and evening, try shifting more of that intake to earlier in the day. Drink steadily, drink consistently, and don't wait until you feel thirsty. Because after 60, thirst is no longer always your most reliable guide. Hydration isn't just about drinking enough, it's about giving your body enough time to use it. And the fifth step: if your dry mouth consistently comes alongside dry or irritated eyes, persistent fatigue, or joint discomfort without a clear explanation, mention Sjögren syndrome by name at your next medical appointment, not because you should assume you have it, but because mentioning it may help your doctor decide whether it's something that deserves a closer look. Sometimes, that one conversation is all it takes to finally connect the dots. Because the goal isn't to worry about every symptom. The goal is to understand what your body may be trying to tell you. Because dry mouth isn't always the problem. It may be the signal. And that brings us to one final thought. As we've seen today, waking up with a dry mouth every morning may be about far more than just thirst. It may be connected to the medications you take every day, to something happening while you sleep, to blood sugar that's been quietly changing, to how and when you hydrate throughout the day, or to a condition that's been dismissed as normal aging for far too long. And perhaps that's the most important thing to remember. Morning dry mouth is incredibly common after 60. But common is not the same as normal. And normal is not the same as something you simply have to accept. Because every single cause we discuss today can be investigated. Every one of them can be identified, and in many cases, addressed. Not by assuming this is simply what getting older feels like, but by understanding what your body may actually be trying to tell you. Because dry mouth isn't just an inconvenience. It isn't just dehydration. And it isn't just age. Dry mouth isn't the problem. It's the signal. A signal your body may have been sending every single morning, quietly, patiently, waiting for you to finally notice it. Today, you learned how to read that signal. And now I'd love to hear from you. Which of the 5 causes surprised you the most? Let us know in the comments below. And if you enjoy learning about the hidden changes that happen after 60, be sure to subscribe to the Aging Code so you don't miss future videos. Because your body has been giving you signals for years. Our job is to help you understand what they may mean. Thank you for watching, and I'll see you in the next video.